is Sarcoma Awareness Month. It's the perfect time to raise awareness of this cancer. It's affecting young adults. And joining us this morning is Dr. John Charleston and his patient Megan to help educate us on early diagnosis and how to find a treatment center. So guys, thanks for joining us this morning.
Thank you. Morning.
Yes, of course. All right, so first, let us all know what is synovial sarcoma and what are the most common symptoms that we can see.
So synovial sarcoma is one subtype of sarcoma, and sarcomas are cancers that can arise in soft tissues like muscle or fat, or can arise from bone. They can arise anywhere in the body, most commonly the extremities. Symptoms could be a lump or a swelling that you can feel that is getting progressively bigger, or it could be a pain that you have that doesn't go away after a month or so, or you can't really explain where the pain came from. Things like that should be red flags that we might be thinking about a sarcoma or a synovial sarcoma specifically, and those, bring that to your doctor's attention.
All right, wow, and so what makes synovial sarcoma so devastating, such a devastating type of cancer, and how does it impact the lives of the patients?
The treatment, if the cancer is diagnosed early enough where it hasn't metastasized, we can treat it with the intention to cure it, but that treatment can involve radiation therapy and chemotherapy, and pretty large surgeries sometimes to get the tumor completely removed. All of that treatment can leave patients with some side effects down the road, which Megan can talk about that better than I can. And there's always the worry of recurrence once you've been through a cancer treatment, which I think is something that patients and we as their doctors have to worry about too.
Yeah, Megan, for you, what made it so devastating in your case?
To put simply, because synovial sarcoma is impacting people so young, it can be just completely disrupting. I was diagnosed when I was 20 years old. I turned 21 while I was going through chemotherapy. And, if you think about what you're typically doing at that age, you don't picture it involving chemotherapy, radiation, and surgery, right? So, impacting these patients in the prime of their lives, it's awful. And the diagnosis time, because of this age gap too, can tend to bring on a lengthy period just to get the initial diagnosis. For me personally, I spent over 5 years seeing doctors, physical therapists, and getting x-rays to try and help with my mysterious shoulder pain, when in reality it was a tennis ball sized tumor that was only going to show up on an MRI scan. So I'm lucky I had a physical therapist at the time who was willing to help advocate to my doctor to help me get those images done. And I'm now 5 years cancer free, but man, it was a long time.
Well, first off, we're so glad that you are cancer-free now, but I can't imagine, definitely, and you talked about, the diagnosis. Why is early diagnosis so critical, and what are some challenges to maybe receiving that diagnosis too?
The odds of the cancer being cured long-term are higher the earlier the stage that the cancer is diagnosed at. And so, yeah, you're right. Early diagnosis is important. Challenges, it's a lot of people have lumps and bumps they can feel or have pain, and most of those are not sarcoma, and so I that makes it, people aren't thinking sarcoma when patients are talking about those symptoms necessarily, so that can delay the diagnosis, and so that's why it's great that you're highlighting Sarcoma Awareness Month and kind of keeping it in patients' minds that they should advocate for scans just like Megan had to, if they need them.
Yeah, definitely. And so what types of questions should patients ask their specialists when it comes to sarcoma?
It really depends on the stage that you're at in your journey. Prior to that diagnosis, it's making sure that you're asking for what you need, right? Depending on if your symptoms are progressing. And once you do have a diagnosis of sarcoma, really make sure that you understand the treatment plan. It's not only important for you to understand, but it's important to make sure that you're receiving the thing that's right for you. And there are, specific places that treat sarcoma, which we'll get to, they know what's best. So making sure that you have that best option, that's going to be important. And just making sure that you have what you need from your care team to help minimize some of those side effects, short-term and long-term, to make sure that you're staying comfortable and healthy.
Yeah, definitely. So where can our viewers go for more information on this?
Yeah, so Sarcoma Foundation of America has a great website for patients with sarcoma. It's called curesarcoma.org. And for synovial sarcoma information specifically, there's a website called flagsynovialsarcoma.com.
Perfect. All right. Well, thank you guys so much for helping us bring awareness to this and honestly teaching us a lot about something that a lot of people might not even know about. So thank you guys for joining us this morning.
Thank you
very much.
Yes, of course. All right, stick around. We'll be right back after the break.